Hello, everyone, and welcome. This is an innovations webinar, and then it's an info session for building healthier workplaces through a coordinated strategic approach. I am your host today, Alejandra from Region 9 Head Start Association. If you have any technical questions, be sure to ask them on the chat, and I'll be happy to help you. This call will be recorded and also shared in a follow-up email, as well as some helpful links and registration links. If you have any questions, be sure to put them on the Q&A on the chat, and they will be answered on a Q&A following up the presentation. So welcome everyone, and I would like to introduce Dr. Aurelia Herman. She is a research director in Healthcare Institute, which is housed in UCLA Anderson School of Management. Since 2001, she has successfully designed a systematic approach to health, promoting intervention in Head Start preschool community settings. She has developed tools and resources for early childhood programs to lead effective healthcare training programs through engagement and dissemination of knowledge, and to better prepare parents to address the healthcare needs of their children. She has received numerous recognition awards in health literacy. She has published in various peer-reviewed journals, such as the Journal of Community Health, Pediatric Emergency Care, and Journal of Health Communication. And without further ado, I will introduce you to Aurelia Herman.
Thank you, Alexandra, and thank you, everyone, for joining. Let me start by sharing my screen. So, as Alexandra said, I'm on the faculty of the UCLA Anderson School of Management. In addition to teaching, we've had really a love story with the Head Start community for the last 30 years. Some of you might have heard, in 91, we started with the Johnson & Johnson Management Fellows Program. We trained close to 2,000 directors so far, and I've been teaching there for the last 30 years. And by getting to know that community, I realized that we have to do more for the families. So in 2001, I created the Healthcare Institute. Now, the goal of the Healthcare Institute was really to empower families, Head Start and early Head Start families, with health tools so they can really be the first in the line of defense for their children's health. And we used low literacy and culturally sensitive tools. Our goal was not to change traditions, but really give families the tools. And we were lucky because we really built this program from the ground up. And we realized that it takes more than just an invitation to change someone's knowledge and behavior relative to health. So in addition of creating low literacy material in 10 languages, we learned from the Head Start community that it's really important to be intentional, to be able to remove barriers that families can face so they come to the training, to make the training exciting and relevant, and make parents feel that they're not alone. So in addition to educating parents, we really work with grantees from across the country to really build this strategic implementation, which really helps you think in your own environment. How are you going to put together a training in such a way that you have high attendance and you do have an impact? So in the last 20 years, we've trained over 200,000 families. We've been in all ACF regions. We've done trainings in 50 states. We trained 4,500 staff to train these families. And we've mainly worked with Head Start and Early Head Start, but we also expanded it to the childcare partners that agencies had, and we worked with 2 or 3 school districts. As you see on the bottom of my slide, you see some numbers, because what we really learned early is that when you do a work, you really want to be able to measure and showcase the impact. And everything that we did was really showing each agency individual their own results. And our program has shown a lot of data points, but some of the most relevant, we have really seen a decrease in school day missed. When parents know when to send and not send their children to school, it really makes a difference. More than 58% decrease in emergency room, and also decrease of work they missed by the parents, because they knew also what to do when their child gets sick. So we have spent the last 20 years really focusing on families. But the truth is that we're really living in unprecedented times, and the Head Start community has really been deeply and continues to be deeply impacted by the COVID-19 pandemic. In response, all the Head Start program across the United States have risen to the challenge and adapted as well as they could, okay, to safely meet the education, the health and nutrition needs of their community. But it did have an impact. And as program continued to move towards fully in-person comprehensive services, prioritizing staff wellness and well-being is more important than ever. We're very close to the Head Start community, and we really heard more than ever in the last year and a half that if we're not going to take care of the staff at any level, they are not going to be able to take care of themselves and then take care of the families and children that they work with. And this is why we decided to put together this new training where we're going to really work with grantees to create a coordinated and strategic approach to promote, okay, workplace wellness for Head Start and Early Head Start leadership and staff. And in other words, we are continuing our strategic implementation because you want to be able to start by listening and realizing what are the problems, what are the stressors, what does the staff want and need. That's the only way to be successful before you start thinking, what do you want to achieve? Not everything can happen at once. It might take time, but I think now more than ever, it is really important to think about the staff that has often been forgotten since the creation of the Head Start community. So we're going to have a virtual training, which will happen starting on May 10th and finishing on June 2nd. The training is going to be over 2 weeks, 2 days a week, every Tuesday and Wednesday from 9 to 1:30 p.m. It seems like long hours, but we have included in that breaks and wellness and lunchtime. But this is really what it takes to progressively build, right, a culture of wellness. So just to give you an idea of the schedule and the curriculum, because we have put a lot of thinking in it, we are going to start with organizational wellness, which really should be the precursor to staff wellness. If there's not a culture of wellness in the agency, you're not going to be able to really put in place staff wellness that will have an impact and will be long lasting. And the leadership has a big role. We're going to work on starting to develop a strategic approach. The name of our strategic approach is SHIP, and it stands for Staff Health Improvement Project. And so in the second week, we're really going to talk about the importance of inspiring the leadership, building teams, so they can then build a positive workplace culture that will help really improve staff wellness. So on week 3, we're going to talk about different tools and different types of modules that you can really take and share with your staff, such as understanding and managing stress post-COVID, such as managing your resources. So these are really modules that you can take as is and share in your agency. How do you build resilience? And in the last week, we're really going to focus on implementation and sustainability. And we have invited some agencies that have worked with us in the past, and in particular, a Head Start director that developed the LOVE model, which we now realize we applied it for families, but so important for staff. LOVE standing for listening, observing, valuing, and encouraging. So to be able to put together these 4 weeks, each agency that will attend will receive the following. First of all, analyze results about what your staff needs, interests, challenges. In other words, you're going to collect the data, we're going to analyze it, and send you your own results, which is really an important part of the first building block. We're also going to have you use a research-based tool that is free, but it's really wonderful because it's totally automated, and you enter your answers, and you really get a landscape of what is the culture of wellness in your agency? And then you can take it a year later and realize the progress that you have done. We're going to share with you adaptable and easy to use materials, because we know that you all pulled in a million directions, and we don't want you to create anything from scratch. So you can take this material and share them. And we're going to walk you through this systematic and stepwise process that will help you really build a workplace health promotion. To build a workplace health promotion is more than to participate to different staff wellness webinars. You want to be able to do it in a coordinated way, an intentional way, and also in a way that your staff needs and cares, because you want to create the engagement needed to succeed. So to be able to put together these 4 weeks of training, I didn't want to put all the list of presenters, but we have faculty from the Anderson School of Management, the Geffen School of Medicine, the Semel Institute of Neuroscience, and the Staff and Counseling Center. These are all UCLA different departments. And from the outside, the Center for Optimal Brain Integration and the Department of Public Health in Cal State University. So in the last 20 years, we've had a journey with the Head Start community. I call it a journey of love. And I just wanted to share with you, these are the kind of comments that we got from Head Start grantees from different levels about what their experience with the Healthcare Institute means. We have the knowledge, but what I would say is we really have the love for this community. And I think it feels in everything what we do. We listen to the communities. We've been in touch with the Head Start community all through the pandemic. We did multiple surveys on the different stressors. We're always there to listen. And it's wonderful to see that people really appreciate this training. So I wanted to share with you this word wall. Now, in terms of logistics, the cost of the training is $6,000 per agency. It includes all the learning material, the pre-post assessment tool, the individual data analysis that we will share with you, and follow up after the training for a whole year. We have multiple webinars to see where you are, what are your barriers. And I think what one of the biggest plus that agencies have told us is that they can really realize that, you know, these are agencies from across the country, and people have similar barriers, but people have different solutions, a different way of surpassing there, so we can learn a lot from each other. The attendance is, we would like you to attend in a team. It's very important, but it's limited to 6 people per agency. We always recommend for the leadership to participate, because this is how you can really implement change. And we suggest that you have the Head Start or Early Head Start director or assistant director, the human resource director, and the health or mental health manager or consultant. So in addition to these 3 that we recommend, it is really your choice to bring any other 3 people that you believe would be important. Now, to apply, and Carol put in the chat, both our brochure that has a link to the application and a direct link to the application. So the application shouldn't take that long, except that we ask you to write a few sentences on why you would like to apply, because we have to be able to make a selection. We are limited to 40 agencies per training, but if we get another higher number, we'll open it. Now, Carol, if you don't mind, put in the chat also our personal email, so mine and Carol Wong, who is the project coordinator for this training. We're here to answer questions, and the deadline to apply is in 10 days. So I know it's a short time, but it shouldn't take you long. You just really need to think. If you're interested, ask us questions if you have any, and we're looking forward to see your application. So I think I tried to summarize, and I'll be more than happy now to see if there are questions or comments.